Hello, I'm Donal McCauley from BJGP. Today I'm talking to Josephine Sauvage, who is the chair of the CCG in North London.
So I'm still very much a jobbing GP. I work in a practice in inner city London in Old Street. I work here 5 sessions, and up until recently I was also a GP trainer. And just very, very recently I was elected to be chair of the new combined North Central London CCG, which combines 5 boroughs, so a fifth of London basically.
Tell me a little bit about your own practice. One of the issues that has come up recently is the issue of death certification and the potential mismatch between the official figures and deaths in the community. What's your experience?
So I would say that I see a number of patients in the community, particularly elderly patients, who maybe have had a brief admission to hospital, who are then subsequently diagnosed as being COVID positive and then discharged. Now, if somebody really decompensates and subsequently dies, then yes, we do have a positive confirmation of COVID that can be added to the death certificate. And of course, people who die in hospital, again, if they have been suffering from COVID, they will have been swabbed, and so you will have a definite confirmation. However, we are beginning to see people in the community who have symptoms very suggestive of COVID. But of course, not to forget that in the elderly, COVID can present very atypically. So not just with temperature or cough or shortness of breath, but with just a sort of increased falls, delirium, confusion, generally going off their feet. And so in those situations, people can deteriorate very quickly without necessarily having a positive COVID diagnosis, because we're not actually swabbing those individuals. So people can die of what would appear to be old age or community-acquired pneumonias, when in fact COVID may have been an underlying reason, but is not actually as a confirmed cause of death, and therefore not appear on the statistics that we're gathering.
People are concerned about PPE. In your role as chair of the CCG, have you had much involvement with practices?
So I think that because we've had to adapt remarkably quickly to the use of PPE, how are we going to see patients who are symptomatic in practices, non-symptomatic patients? It's been a real challenge, I think, for GPs to get their heads around how this should be done. So there was very much the need to have a new mechanism to deliver PPE to surgeries, and also to enable practices to access the correct specification of PPE in a timely manner. In particular, at the moment, there's an issue around the availability of goggles, but we are constantly reviewing, receiving information, responding, and helping people to access the equipment so that it is there when they need it.
Finally, could I ask you about your own colleagues in the North London CCG?
Certainly amongst my peers, I have had a number of peers and colleagues in all lines of work who have had symptoms. I think in North Central London, yes, we have had a couple of health professionals who very sadly have died. And of course, you know, our hearts go out to them and their families, particularly given that there is an association between their death and working within the NHS delivering services to other people.
Today, I've been talking to Dr. Josephine Sauvage, who is the chair of the North London CCG, and indeed herself a GP on the front line who's experienced COVID, both from an organisational and a practice perspective. Thank you very much indeed, Josephine, today.
Thank you, Donal. Thank you.